I'm Sam Shemansky.
I'm Adrian Santiago.
We are here today at the Illinois Cancer Specialist Center to interview with Dr. Leonard Klein about how stem cell transplant helps with the treatment of multiple myeloma. This is Dr. Klein, and he will be interviewed by Adrian Santiago.
We would like to ask you a few questions on how stem cell transplants helps with the disease of multiple myeloma. First off, what has been the most common disease or cancer that uses stem cells as a treatment?
So in the United States and around the world, multiple myeloma has now become the most common transplant where we use the patient's own stem cells, and that's called an autologous transplant.
Okay. And is there a certain criteria patients have to meet to be allowed to go through stem cell therapy?
They generally have to be fairly young patients. We usually will transplant patients when they're less than 65 years of age, but occasionally older patients who are in very good, we call performance status and good health, can still be transplanted.
Okay. And how does the stem cell transform into the specific cell that you are looking to make?
So stem cells are the mother cells. They live in the bone marrow, and they make all the white blood cells that help fight bacterial infection, make the immune cells of the body, make red blood cells to prevent anemia, carry oxygen, and also make little particles in the blood called platelets. They normally live in the bone marrow. Very few are in the blood. In order to do a transplant, we have to get the stem cells from the bone marrow into the bloodstream. And we generally can give a patient growth factors or very high doses of chemotherapy. And then when they recover, we actually do a procedure called apheresis. That procedure is when we take the blood from the patient, put it into a machine, spin it very, very fast, and siphon off the stem cells into a bag. We then mix it with a preservative called DMSO, and then we freeze it in our cryopreservation laboratory at the hospital using what's called a rate-controlled freezer. And we get the temperature down to minus 80 degrees, and we freeze it away.
All right, and then more specifically, how does stem cell therapy help treat myeloma?
So most myeloma patients, although they can respond to initial therapy, the myeloma cells become very resistant to the chemotherapy. So in order to overcome that resistance, we use very high doses of chemotherapy. And we have to be sure that the patient's heart and lungs and kidneys can tolerate it. But it's so high that it would damage the bone marrow irreversibly, so patients would die from bleeding problems or infection. And so once we are able to preserve the stem cells and freeze them in the freezer, we then give the patient very high doses of chemotherapy, not worrying at all what's going to happen to the bone marrow. And once the chemotherapy is metabolized out of the patient's blood system, we then thaw the stem cells, transfuse it back into the patient. And the stem cells are very smart. They will hone into the bone marrow itself. Then usually within 10 to 14 days after the infusion, the patient's own white blood cells will grow enough to protect them from any infection.
Okay, and how long is the stem cell treatment?
When we give the stem cells, we transfuse them into the patient very fast.
Okay.
But most patients are in the hospital for somewhere between 14 to 18 days. They get 2 days of chemotherapy, and it takes about 10 to 14 days until the stem cells start to grow within the bone marrow. And they're able to produce the normal blood cells for patients, so it makes it safe for them.
Okay. And with the help of stem cells, would cancer be curable?
Some transplants that we use stem cells for can be considered curable, yes. Others, it just provides us a way of putting into patients into very long-term remissions where we really would not be able to do so without the high-dose chemotherapy and these specific stem cells. So multiple myeloma, we're trying to give people real long remissions, although with multiple myeloma, it's not still considered curable, although we're working on that.
And where do you see the future of stem cells going?
So we're hoping that the stem cells will not only be used to salvage the bone marrow, but that we can manipulate the stem cells to initiate a very good immune response. So when they grow, not only do they just replenish the bone marrow, but they will also initiate an immune reaction against the cancer cells and kill them off. And then maybe we can cure patients.
Okay. And have you ever received an opposition for using stem cell research?
So doing research in this country is very hard. Everything we do is based on the evidence that has been occurring through what's called clinical trials, where patients and families agree to undergo different types of therapies, new therapies, so that when we learn how a treatment works, it's due to the volunteering of patients and their families to learn how to make each transplant better. Occasionally, patients don't want to have a stem cell transplant. Occasionally, insurance companies will say no to the transplant, and that's where we get most of the opposition from.
And now, thank you for taking your time to address this very important topic. And that would be all for today.
You're welcome. So what you heard is when I talk to patients, I tell them those same things.